So good day, Ma'am Jack and everyone. We are Team 7 and we were we will gonna discuss this bone condition called fibrous dysplasia. So I am Althea Yabut, and along with me that will report is Miss Angelica Berquillo, Mariah Juliana Torres, Princess Nicole Llaneta, and Miss Michelle Mabalay. So this is our topic outline. First, yung general overview muna about this condition. Next is diagnosis of fibrous dysplasia. Like, paano ba siya nade-diagnose? Like, with the use of X-ray ba or other scans para malaman na ang isang individual ay may ganong bone condition. And next one is the commonly affected parts. Kung ano lang nga ba yun naaapektuhan na bone dito sa condition na ito. And next one is what are the signs and symptoms and causes of this bone condition, which is the fibrous dysplasia. And next one is we're gonna talk about yung treatment, prevention, or more. Kung natitreat ba siya by medicine or ayan. And lastly, who treats fibrous dysplasia? What kind of doctor that we will seek if yung individual meron na to. So let's start. So general overview. Fibrous means the characterized by fibers. So dysplasia, meaning a term used in pathology to refer to an abnormality of development or an epithelial anomaly of growth and differentiation. So what is fibrous dysplasia? Fibrous dysplasia is benign and it's non-cancerous. Ibig sabihin, it's small chance lang talaga. It's rare na maging cancer siya. So this bone condition in which abnormal fibrous tissue develops in place of normal bone. Meaning to say that kaya nagkakaroon ng ganitong bone condition because napapalitan na abnormal tissue yung place ng normal bone. Like here sa ibis na, 'di ba? We know naman yung itsura ng bone is which is hindi naman ganito. So napapalitan siya ng abnormal tissue kaya merong fibrous dysplasia. As these areas of fibrous tissue grow and expand over time, they can weaken the bone, causing it to fracture or become deformed. Anyways, the condition is different. The condition is generally divided into two types, which is the monostotic fibrous dysplasia and polyostotic fibrous dysplasia. So, dito na muna tayo sa monostotic fibrous dysplasia, meaning that only a single bone is affected. This is the most common form of the condition. And sabi dito that iisa lang yung naapektuhan kung sadya lang na fibrous dysplasia doon lang, hindi sa ibang parte. Kasi kapag meron pa sa ibang parte, which is kung meron pang fibrous dysplasia sa hip, ay sa jaw or sa hip or sa pelvis, ibig sabihin meron ka ng polyostotic fibrous dysplasia. Meaning to say that this individual, yung more than one bone is involved, it can affect more than one bone within the same limb or multiple bones throughout the body. This form of the condition is usually more severe, and for this reason, it is typically discovered earlier in life, meaning to say that kapag polyostotic fibrous dysplasia yung meron ka, most likely halata na halata. And compared sa monostotic na lately pa siya nade-discover, pag polyostotic, mas nade-discover siya ng maaga. And the next reporter will be Miss Berquillo and will discuss kung paano ba nadadiagnose ang bone condition na katulad nito.
Good evening, classmate. Good evening, ma'am. So, after knowing the meaning and types of fibrous dysplasia, now we are going to talk about on how this disease can be determined by the doctor. There are different types of tests that the doctor may order to the patient for them to be able to diagnose or know the exact location of fibrous dysplasia, but it also may differ on the location and severity of the symptoms. So, number one is the X-ray. We all know that X-ray is the most common test that doctors use to diagnose fibrous dysplasia or other diseases. So, an X-ray also can evaluate the bone structure or the disease and diagnose fractures and misshapen bones. So, in the sample picture of an X-ray, we can see that the affected part of the body is the upper leg or the femur. In this case, the doctor can be able to see where the exact location is. So, an X-ray is a diagnostic test which uses invisible electromagnetic energy beams to produce images of internal tissues, bones, and organs onto film. Also, X-rays are performed for many reasons, including diagnosing tumors or bone injuries. Next is the magnetic resonance imaging, MRI, or the computed tomography or the CT scan. This test is to provide detailed images that are analyzed by computer and are helpful in evaluating the skull and facial bones for the disease. So, MRI also useful in demonstrating the proliferation of fibrocellular tissue. So, in this example of the CT scan, wherein the affected part is the tibia or the lower leg, we observe that unlike the previous test or the X-ray, this test is showing a detailed image. So, there are different features of CT scans, including the ground glass opacities, homogeneously sclerotic and the cystic, well-defined borders, expansion of the bone with intact overlying bone, and the steel scalloping may be seen also. So, this CT scan, sabi ko nga kanina, these are more detailed than general X-rays. They shows detailed images of any part of the body, including bones, muscles, fat, and organs. Also, CT scan provide a greater clarity and reveal more details than regular X-rays exams of internal organs such as bones, soft tissue, and blood vessels. So, CT scan can also increase or minimize exposure to radiation. This also allows different views of same organ or the structures. It was also considered the modality of choice in evaluation of fibrous dysplasia, especially in setting of craniofacial lesion. Next is the bone scan. This test is to evaluate the entire skeleton, helping doctors understand the amount of bone in the body affected by the disease. In the picture, we can see that it is a bone scan of a 30-year-old female with a history of fibrous dysplasia. Also, the scan shows that the affected part of the body is the right mandible and the temporal bone. So, these bone scans revealed increased uptake, but are most useful for identifying the distribution of lesion in polystotic diseases. So, this bone scan can help the doctor determine what are the affected part of the body. What are the affected part of the body of these diseases? Kumbaga, halimbawa, halimbawa, mm, dahil gusto malaman ng doktor kung alin pa yung mga naapektuhan ng disease na to, gagamitin niya yung bone scan. Ito nga yung ititest yung entire skeleton ng isang tao. So, next is the bone biopsy. During this test, a doctor takes a small amount of tissue from the area affected by the disease to examine under a microscope. So, um, by taking a small amount of bone tissue, they used a needle biopsy to establish a diagnosis of fibrous dysplasia, especially in monostotic cases. So, this biopsy, this type of procedure in which samples are removed from the body by a needle. Yun nga, 'di ba? Ginagamitan nila ng needle para makakuha ng small amount of tissue sa affected area ng body natin. So, then it is being examined under the microscope to determine if it is a cancer or other abnormal cells are present. So, this biopsy may be necessary to confirm the diagnosis of fibrous dysplasia. So, the next reporter is Miss Torres for the affected parts of the body by fibrous dysplasia.
Good day everyone, I am Torres Mariah and I will discuss the commonly affected parts of the bone in fibrous dysplasia, as well as comparing the anatomy of normal bones and any other areas affected. Why do you think healthy bones are important? Strong bones begin in childhood. It supports us and allows us to move. They protect our heart, lungs, and brain from injury. Weak bones break easily, causing terrible pain. You might lose your ability to stand or to walk. Any bone can be affected. More than one bone can be affected at any one time. When multiple bones are affected, it is not unusual for them to all be on one side of the body. However, fibrous dysplasia does not spread from one bone to another as what my groupmates has been discussed. The most commonly affected bones are the skull and facial bones, femur or upper leg, and tibia and fibula or lower leg, and humerus or upper arm bone, and ribs. So here we can see the case of craniofacial fibrous dysplasia that is related to fibrous dysplasia, which can affect any bone in the body but most commonly the long bones in the legs and arms. The condition, sometimes called facial fibrous dysplasia, may affect one bone or multiple bones. Also, it may cause shifting of facial features and facial asymmetry, such as incorrect placement of the eyes, misalignment of the jaw, and other problems. Severe deformity in the facial bones can lead to loss of vision or hearing. The patient with fibrous dysplasia involving the jaw and cranial base, as we can see in her jaw, it is not perfectly aligned or normal. It happens within the upper and or lower jaw bones, the maxilla and mandible, or on both sides of the face. Next one is the femur or upper leg. As we visualize in this X-ray photo, this bone part is the common location of fibrous dysplasia, which may be asymptomatic or present with bone deformity. Because of weight bearing on weakened bone in the proximal femur, it can lead to hip deformity and to shepherd's crook deformity. Then we have the tibia and fibula or lower leg. In these X-rays, the tibia has become bowed from fibrous dysplasia, bowed meaning bending or abnormal curvature of a long bone. Bow leg deformity is an incorrect alignment around the knee. One of the cases is the osteofibrous dysplasia that affects the tibia and is confined to the cortices. Tibial bowing especially refers to bowing of the diaphysis of the tibia with the apex of the deformity. As we can see in this X-ray, um, the lower leg was bowed, meaning bend. Next is the humerus or upper arm bone. As we can recall earlier the proximal femur case of fibrous dysplasia, it is also characterized as it occurred in cortical bone in the shaft of the humerus, the white arrows, resulting that the arm is bowed, as you can see in the red arrow. Here is one of the patients followed over time with fibrous dysplasia of the humerus. This study reported a case of osteofibrous dysplasia arising in the humerus of an adult. Most proximal humerus fractures can be treated without surgery, as according to this study. Also, one of the common locations of fibrous dysplasia is at the benign bone lesion of the ribs. They are usually clinically silent and found incidentally. Occasionally, they may cause pain, which is sometimes the result of a pathological fracture. Moving on to the comparison of the normal human body bones and the human body bones with fibrous dysplasia. Let us look at these pictures. This X-ray on the left is the one who has fibrous dysplasia and the right photo is the normal one. And the other picture is the distribution of monostotic fibrous dysplasia. The first location is where the craniofacial dysplasia or the fibrous dysplasia of the skull, where the upper and lower jaw bones, the maxilla and mandible is misaligned that we use for eating, biting, and chewing. The second location would be the upper arm bone or humerus that we use for carrying heavy objects and helping your arm move, flex, and rotate, including your elbow and hand. The third is the ribs, which part of the rib cage that protects the organs in the chest, such as the heart and lungs from damage and assist in respiration. Also, it is part of the axial skeleton that is connected to the sternum with a strong and flexible material called cartilage. Next is the femur or upper leg and the tibia and fibula or lower leg. The role of these two bones is to provide stability and support to the rest of the body, for example, as we walk. The femur holds the weight of your body when you stand and move connecting muscles, tendons, and ligaments in your hips and knees to the rest of your body. And the lower leg refers to the portion between the knee and ankle. The lower leg plays a key role in standing, walking, running, jumping, and other weight-bearing activities. And that is all. Thank you.
Good day. So the cause and effect or the symptoms on the bone of fibrous dysplasia. Let's talk about first the cause. Gene mutates or changes while the baby is developing in the womb, causing bone forming cells to fail to mature, and only specific bones will have the disease. What happened here is that they produce an abnormal fibrous tissue in certain bones, and the gene change happens while the baby is developing. It is also says here that only specific bones will have the disease. This means that the fibrous dysplasia does not spread from one bone to another. Second, the cause of this gene mutation is unknown. It is says here that even though the cause of fibrous dysplasia is because of gene mutation, the gene mutation itself is unknown on why they mutate. But it appears that it is not inherited from parents, or it will not be passed on to a child. And this gene mutation occurs after conception, resulting in the development of fibrous bone tissue. Third is does not influence by race, sex, heredity, environmental exposure, and geographic location. So that means that these factors are not the reason to cause someone to have this disease. It all falls to a gene mutation. Now let's talk about the effect or the symptoms of fibrous dysplasia on the body. First, the pain. The affected area can become weak and painful. So this pain is more likely to occur if the bone that is affected is one of the weight-bearing bones, like our legs or pelvis. So it begins as a dull ache that worsens with activity and lessens with the rest, and it can progressively worse over time. The second is bone fracture. A fracture often occurs after a period of dull pain, although it may also happen suddenly with no prior pain at all. So, when a person who has a fibrous dysplasia, their fibrous bone is weaker than a normal bone, and it can sometimes break or fracture, causing a sudden and severe pain. So this is an example of fibrous dysplasia in the thigh bone, who has a fracture. The third effect is a bone deformity. Poor healing from repeated fracture can lead to bone deformity. It is noticeable if the deformity occurs in facial bones and leg bones. In a severe deformity, in a facial bone can lead to loss of vision or hearing. And if it is in the legs or pelvis, they may have trouble walking or may develop arthritis. This is the example of a deformity on the thigh bone. The second example is a um, deformity in a tibia. It it bowed from fibrous dysplasia. Another effect or symptoms is hormonal disturbances. So young patients with hormonal abnormalities may develop early puberty. So it is more common in girls than boys, and it is said to be the cause of hyperactivity of the ovaries. And this hyperactivity may occur in other glands also. So this or the hyperactivity in other glands. In thyroid gland, it causing anxiety, weight loss, and abnormal sweating. In adrenal glands, causing weight gain and diabetes. In pituitary gland, causing milk production in women, gigantism, which causes the person to grow very tall, and hormonal disorder called acromegaly. It is a disorder that occurs when the person's body makes too much growth hormone, and it causes the bones, body organs, and other tissues to increase in size. In parathyroid gland, causing high level of calcium in the blood. Another effect is the skin discoloration. Pigmented skin spots, referred to as scapholulate spots. It is oftenly seen in a person with hormonal abnormalities and fibrous dysplasia. So this is an example. Um, it shows here the common sign of fibrous dysplasia, the light brown scapholulate spot. And lastly, changes in symptoms. Very rarely, areas of fibrous dysplasia can become cancerous. When this happens, the signs of this are rapid increase of swelling or growth of an injured part, and the person who has fibrous dysplasia experience an increasing pain, especially when the pain does not easily go away with rest. So, to further discuss our topic, Miss Michelle Mabalay will continue the discussion. Thank you.
Fibrous dysplasia occurs in childhood, usually between at the age of 3 and 15. Boys are more often diagnosed with fibrous dysplasia than girls, except for one specific type of polyostotic fibrous dysplasia. And this is the McCune-Albright syndrome, which is commonly for girls. So, children with McCune-Albright condition have weakened bones that break easily. The disorder is present at birth, but symptoms may not appear until later in childhood. So, McCune-Albright equally affects boys and girls. When it comes to treatment for fibrous dysplasia, it's sad to say that there is no cure for this. But among possible objectives to treat this disease, such as treating and preventing fractures, correcting misshapen bones when the bowing is severe, and last is managing pain. If the person having this disease do not have any symptoms and are not at risk for a fracture, the doctor may recommend monitoring the condition. But if symptoms exist, treatments may include physical therapy to help strengthen muscle and improve range of motion, and also cast, splint, or brace to immobilize fractures or improve mobility, and also the surgery to prevent and repair fractures, treat scoliosis, and repair misshapen bones. For those persons who suffer from this disease, may see different healthcare professionals depending on the location of the disease and the severity of the symptoms. Here's the different specialists that may help you assist in this kind of circumstances. First is orthopedists, who treat and perform surgery for bone and joint diseases. Dental providers such as dentists and oral maxillofacial surgeons who provide dental care and treat problems of the mouth and jaw. Endocrinologists who treat bone problems and problems related to the glands and hormones. Occupational therapists who teach how to safely perform activities in daily living. Ophthalmologists who specialize in treating disorders and diseases of the eye. Otolaryngologists who treat ear, nose, and throat disorders. Physiatrists who specialize in physical and rehabilitation medicine. Physical therapists who teach ways to build muscle strength, recover from broken bones, and prevent broken bones. And last is the primary care physicians who diagnose and treat adults and children. When possible, try to work with healthcare professionals familiar with treating fibrous dysplasia.